Hi everyone, my name is Melissa Tarr. My PICOT question is, in hospitalized adult patients, how does hourly nurse rounding compared to rounding every 2 hours affect patient fall rates during hospitalization? Falls are a major patient safety concern in acute care settings and can lead to serious complications, longer hospital stays, and increased healthcare costs. Because nurses are directly responsible for monitoring patients, rounding frequency plays an important role in fall prevention. This presentation will review current literature and provide an evidence-based recommendation on this topic. To find relevant research, I use the databases including CINAHL and PubMed. The key search terms I used included hourly rounding, fall prevention, acute care, and patient safety. I applied filters to include only peer-reviewed articles published within the last 8 years and focused specifically on adult inpatient populations. From this search, I selected 6 research studies that were most relevant to my PICOT question. This study was a large cluster randomized control trial that compared intentional rounding to standard care in internal medicine patients. The results showed that structured rounding improved patient safety outcomes and reduced adverse events. This supports the idea that consistent and intentional rounding plays a key role in improving overall patient safety. This randomized trial evaluated a fall prevention toolkit used in acute care settings. The intervention included structure rounding along with other safety strategies. The study found a significant reduction in both fall rates and fall-related injuries, suggesting that combining rounding with additional interventions can improve patient outcomes. This multi-site study examined the relationship between nurse communication, rounding practices, and patient falls. The findings showed that improved nurse communication along with consistent rounding was associated with decreased fall rates. This highlights that both the frequency and quality of nurse-patient interactions are equally as important. This quasi-experimental study focused on purposeful hourly rounding. The results showed a reduction in patient falls as well as improvement in patient satisfaction. This suggests that hourly rounding not only improves patient safety, but also enhances the patient experience. This study explored the impact of bedside shift report combined with rounding practices. The findings showed that these combined strategies were associated with lower fall rates. This reinforces the importance of communication and continuity of care in fall prevention. This quasi-experimental study evaluated the use of a smart patient monitoring system. The results showed a significant reduction in inpatient falls. This suggests that technology can enhance patient monitoring, especially between rounding intervals. Overall, the literature consistently supports that more frequent rounding, particularly hourly rounding, is associated with a reduction in patient fall rates. Studies show that increased rounding frequencies allow nurses to anticipate patients' needs and intervene earlier, which reduces the likelihood of patients attempting any unsafe movements on their own. While not all studies directly compared hourly rounding to every 2 hours, the evidence suggests that less frequent rounding may lead to missed opportunities for intervention. Additionally, multifactorial approaches that combine rounding with communication strategies and fall prevention tools appear to be the most effective. Technology can also play a supportive role, but it should not replace direct nursing care. Overall, consistency, frequency, and strong nurse-patient communication are key factors in reducing falls. Based on the current evidence, I recommend implementing structured hourly rounding as a standard practice for hospitalized adult patients. Hourly rounding allows nurses to proactively address common fall risk factors such as pain, positioning, toileting needs, and environmental safety. Compared to rounding every 2 hours, hourly rounding provides more frequent opportunities for early intervention and reduces the likelihood of patients attempting unsafe activities independently. It is also important that hourly rounding is implemented consistently and combined with other fall prevention strategies, including patient education and effective communication. Overall, adopting a structured and proactive approach to rounding can significantly improve patient safety and reduce fall rates. You can review my references on this slide. Thank you.